For those struggling with mental health disorders like PTSD, depression, and anxiety, treatment options can be limited. Emergent therapies have some patients and doctors excited, but are still in early stages.
I went to a ketamine clinic here in New York to learn more about a new kind of therapy.
I don't think I thought I would see my 21st birthday.
Room 9?
Jessa Common says ketamine therapy changed her life.
I was a bystander at the Boston Marathon bombing, and I walked away from the finish line right before the bombs went off. I was subsequently diagnosed with PTSD. I had already done other things that had helped, but obviously did not eliminate my PTSD symptoms.
Walk us through that first time.
You kind of feel this dissolution where you separate from your body. You realize that everything is so temporary. My suffering is temporary. Once you know that, it's easy to transcend your fear of things.
Nishama Therapeutics, where Jessa is receiving her infusions as part of her overall mental health plan, is part of a growing trend using ketamine, a controlled substance to help treat a range of mental health disorders like PTSD, depression, and anxiety, paired with traditional talk therapy. For Jessa, it was years of other therapies till she found relief through ketamine. Intravenous ketamine was approved for use as an anesthetic decades ago and can be used under supervision of a healthcare provider. Doctors use this form of ketamine legally through a process called off-label prescribing.
Who's coming here?
So people, mostly treatment-resistant people who've been on years of psychiatric treatment, and they sort of reached a wall.
The average antidepressant takes about 2 months to produce a reduction in symptoms. Ketamine produces those same kinds of improvements within 24 hours in many people.
Dr. John Crystal has been studying ketamine at Yale for 39 years.
The results are really remarkable.
It is a game changer for many people.
MRI data may allow us to see the change that can happen in the brain after ketamine therapy.
One of the things that's regrowing are the integrity of the inputs to a nerve cell. The regrowth of those dendritic spines, the regrowth of those synapses.
And ketamine's effect appearing to work on a cellular level to cause more positive thoughts and behavior. Like all medication, ketamine is not for everyone. The long-term effects, as well as the ideal dosing and treatment frequency, are still being studied. And there's a risk ketamine could induce a psychotic episode in certain patients.
People who have the diagnosis of schizophrenia, so far, we would not recommend. But there are also people who are developing a psychiatric illness. We would typically also not treat with ketamine, just in case they had a vulnerability to schizophrenia.
Dr. Crystal claims that for those who can use ketamine, a high percentage of patients can see remission after just one session, and says that many more may continue to see relief with occasional maintenance doses.
I think of ketamine as an intervention that is part of an overall treatment. Ketamine can be something that can facilitate and enhance the impact of psychotherapy, which people will also get oftentimes when they're getting their ketamine treatment.
You think there's a lot of hope to come?
We have to be very patient about how these transformative new insights into the brain translate to new treatment. But I'm extremely hopeful.
How different is your life now than when you first started this journey?
It's much freer. I feel freer. That's something everyone should feel. I wanted to heal, to feel better, for one, but also to show that it's possible. And I wanted other people to know that it's possible.
And Dr. Jen, there's been so much promise in these studies that a drug maker has actually created a drug that's a derivative of ketamine that's now FDA approved for treatment-resistant depression.
Yeah, I mean, and we've talked before, this area of psychiatry,
loosely under the umbrella of psychedelics, is really exploding in research and development and treatment and access. That FDA-approved cousin, you can think of it kind of as a cousin to ketamine, it's S-ketamine, is a nasal spray. But we have to remember, a derivative of a drug is not the same thing as a drug. So it has a different side effect profile, it has different indications, different dosing, different cost. The bottom line here is if you're considering either of these or any type of treatment under the umbrella of psychedelics, this is not a DIY type of thing. This isn't let's look online and go for the cheapest or the closest location. This should be done ideally under medical supervision and ongoing professional medical treatment and management. But there's a lot of interest and a lot of excitement because there's a lot of potential.
Good job.
Thanks, guys.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.